My name is Susan Downs. This is the Silicon Valley Health Institute. We have top-notch world speakers come in to share their information so that you can be proactive in your health and don't have to wait to take a pill. Our future presentations on April 22nd at 7 a.m. We'll have William Davis, who wrote Grain Belly and's got very interesting information on why we're not losing weight. On May 15th, we'll have Anthony Haynes, a top-rated nutritionist from England, who's very, very clever, very, very intuitive. And in June, we'll be talking about new German medicine with Andy Locke-Mears. So Dr. T has a lot of experiences. He's got an MD that I think he obtained in Russia. He's attended top schools. He's got a doctor of chiropractic. He's have a lot of humane ventures in Nepal and helping poor, impoverished children. And his goal is to make the world better. He's got so many certifications, it's too numerous for me to count, and too many skills for me to even begin to remember. So welcome, Dr. T.
Thank you very much, Susan. My pleasure to be here. Today we're going to cover a few new issues and interesting issues within skin, the arena of skincare that normally I haven't spoken about in the past because I was focusing much more on issues like skin lesions, skin cancer, mucous membrane lesions, mostly growths, mostly cosmetic, aesthetic. But recently there's been a huge increase in different skin conditions that I have not seen that much before. And I felt like it was a good idea to cover some of those in some depth so that you are all aware of them, because every day you see people around you and you can help them and you can diagnose them. I'll give you a couple of examples. In the last few weeks, I attended a few events that were orchestrated by influencers, people who have millions and millions of followers. Some of them are doctors, but most of them are people who just like the technology of the internet and knew how to position themselves to have a lot of followers, which takes a special skill, a skill that I'm not that interested in personally, but those who are good at it can amass a huge number of followers. So I've met some people who have hundreds of millions of views on their Facebook or on one of the other network internet platforms. And those people are pretty charismatic. They have the ability to impress people, even if they have barely any credentials. They reach a huge number of people, and it would be very smart for people who do have credentials to align themselves with some of those people who reach the millions, just to get the information out. The interesting thing is, being that I'm the only one in the holistic circuit who lectures about a holistic perspective on skin lesions, skin cancers, and other conditions of the skin, including evaluation, metrics of the skin, and all other things related to it. As a result, everywhere I go, all the doctors that are present immediately become my patients. And all of those multi-millionaires in terms of followers also become my patients, because I just have to look at them and immediately diagnose something on their skin, and that's it. They want to immediately come and see me to save them from whatever condition they have. So the skin is so important for people who are in front of the camera all day long. But even those among us who are only in front of the mirror once or twice a day are interested in looking well, looking healthy, and not having major defects or major diseases of the skin, which are easily able to disturb our self-confidence and prevent us from living a happy, complete life. it's very important that our appearance represents our energy, our bright mood, our ability to befriend people, our socializing skills, and so forth. And people who are uncomfortable about their own appearance usually hide, usually don't get in public, and they miss out on a lot of things in life. So if we can help them, it's a great service that we provide humanity. And I recommend you listen carefully, because some of the things that I will mention to you, you will see it in people around you beginning the next 5 hours or the next day. So some of the people that I have diagnosed instantly just by seeing them during those events immediately started looking around and brought me other people that they saw in the event, because they started diagnosing them. So they brought them to me to tell them, look, this guy can help you. So it is so easy and quick to help people when you see skin issues, and when you learn a lot about what those skin issues can do to the rest of their body and how they are related or correlated with other diseases or conditions, you will feel really blessed to have had the opportunity to help other people. And this is something you don't get very often with other types of conditions. But with skin, you can all become diagnosticians. And in some ways, you'll be better diagnosticians than some skin doctors who ignore a lot of conditions that they just don't know what to do about. So the first thing we're going to talk about is a very common autoimmune disease. So common that recently, when I traveled in other countries, and even in the United States, I see so many children with that autoimmune condition that used to be present only in adults. Almost 1 out of 3 children that I see in places where people are having poor diet, poor exposure to healthy environment, are now developing this condition. And many, many adults as well. So I'd say maybe 1 out of 4 or 5 adults that I see have this condition. And in some societies, I would say that 40 to 50% of the population have a variant, at least one variant of that condition. So the condition is really popular. It's called rosacea. And it's so common among Caucasians that every day you see people with rosacea and you don't even think about it because they don't always appear the same. There are 4 major types of rosacea. Most people are accustomed to seeing just the first one, the one that has redness and widened blood vessels on the face, mostly on the center of the face, on the cheeks. Those are so common that we don't even pay much attention to them, but people are disturbed by them. Plus, they have some other symptoms associated with them, in addition to some studies that show that people who have rosacea have a higher likelihood of developing dementia or Alzheimer's later on. That's a tidbit you should be aware of. Plus, if you have one autoimmune disease that is mild, that doesn't affect your day-to-day life, only an inconvenience in terms of appearance, there is a likelihood that other autoimmune conditions will develop later that are more substantial. Therefore, it behooves us to pay attention to our rosacea and to start figuring what are the triggers, the mediators, and the antecedents of autoimmunity that we are probably suffering from even without being aware. Because if you do some tests and learn what those are, you can truncate them in their buds, nip them in the bud, don't allow them to develop into a full-blown autoimmune disease. So it's actually a great opportunity when we have a superficial, non-significant autoimmune condition telling us that something is wrong with our gut, with our inflammatory tendencies, with our immune system being dysregulated. All of those are opportunities for us to do more to help the rest of our body and prevent other autoimmune conditions. So what I want to focus on is not necessarily on the first type of rosacea, although we can treat it partially with endovenous radiofrequencies. We can close off the capillaries that are enlarged. That's called telangiectasia. Telangiectasia is widening of the diameter of the small blood vessels on the skin of the face. And I believe that this condition has a lot to do with the neurovascular apparatus of the brain, because the skin of the face is connected to the cranial nerves. So cranial nerves 5 and 7 especially are bringing motor and sensory information to the face. And therefore, if there's anything going on with those cranial nerves, it may affect how blood vessels dilate and create an inflammatory process because of the dilatation of the blood vessels, which creates redness, inflammation, flushing, heat, itching, and other symptoms, sometimes even a little pain when people have a flare-up. And the flare-ups are usually associated with inflammatory foods, inflammatory behaviors, exposure to very hot sauna and other sources of heat, as well as stress and emotional issues, all of which will easily connect with the brain and will explain why later on a person will develop dementia or Alzheimer's. So we can treat at least the appearance, the manifestation of the blood vessels using radiofrequencies, which is a non-invasive approach. It doesn't work 100% because some of the redness is not in the capillaries. And most important is to find out the triggers, the mediators, and to deal with it like you would deal with a neurological condition, a vascular condition, and an autoimmune condition all put together. That would be the best approach to address the first type of rosacea, which is called the erythematotelangiectatic rosacea. That's the first type of the 4. The second type is called the papulopustular rosacea, and that is less noticeable for the outside world. But if you look closely at some people, you'll see that their face, especially their cheeks, and the central part of the face appears to be thickened a little bit. The skin has enlarged pores, and it looks a little hypertrophic, like it's grown a little too much. It's not very common, but when you notice that, you will say, why do they have an unsmooth face? And they don't always have significant erythema. The redness is not always noticeable. They don't have telangiectasia, so they don't have those visible blood vessels right on the cheeks that you can immediately say this is rosacea. So you have to look at them from closer distance. What's important about it clinically is the fact that if you try to treat them with a laser or surgical approach to remove those hypertrophic areas, those slightly thickened part of the skin that have the enlarged pores, if you want to do something about it and treat it, you may end up creating divots in the skin. So you either treat the whole skin, or if you treat one little area, you have to be extremely gentle, because this superfluous tissue, a lot of which is loose connective tissue with fibrocytes in it and fibrosis, it will easily be eliminated more than you plan to eliminate. So either you do a comprehensive work and you feather things out, you have to identify that type of skin in order to avoid creating divots that would make the patient upset, even if you can smooth them out later. Because once you realize what's going on, you can do it at a later phase. But patients don't like to wait that long with those divots. So in that situation, you better diagnose it up front. But these you're not going to see as much. The third is the one I'm going to discuss most often and most in depth today, because the third is one that affects people's appearance tremendously. People are self-conscious about it. They are ashamed about it. They hate looking in the mirror. And they commiserate a lot because there is no really good medical solution. There are some surgical approaches that are very bloody. And once you see even the least invasive of all of those procedures, you would tell yourself, no way, I'm not going to go through that. So we happen to offer the world's only non-surgical solution to this condition, which is a part of the third type of rosacea. And this is the Dermophyma or Phymatus rosacea. The Phymatus rosacea is actually possible to occur anywhere in the face, but it's most common in the nose. And that's why it's called Rhinophyma. So phyma refers to the growth of the tissue, the hypertrophy of the tissue. And if it happens on the nose, we call it Rhinophyma. So what happens is in the lower part of the nose, we have a lot more sebaceous glands. And the vascularity and the inflammation associated with it and the immune reaction of the autoimmune component are causing hypertrophy and enlargement of the sebaceous glands. They get bigger and bigger, and then you can start seeing the pores. Where you have the highest density of pores is the lowest half of the nose, from here down. From here up, people maintain a normal nose. But only from here down, it suddenly gets bigger and bigger in all directions until this groove that we have here disappears. And the nose starts going straight down with all of this area filled up on both sides. So the nose first gets bigger and bigger that way. Then the pressure increases until the nostrils become smaller and smaller, and people start having difficulty breathing. They don't know it, and they don't know why, because they go to eye, ears, nose, throat doctors who will never diagnose it. And skin doctors usually ignore it too because they don't know what to do about it. So a lot of people don't breathe well because their nostrils became too small and too tight, as the thickness occurred also on the side of the nose right above the nostril. As they all get thicker and thicker, and even on the top, it can grow that way. So it starts growing further away from the face, and it becomes more and more bulbous until finally it can be called a drinker's nose, alcoholic nose, whiskey nose. They have all those terms for it because people used to think it had to do with drinking, but it really doesn't. It's true that when you drink alcohol or stimulants or some spicy foods or processed foods or sugar or food that you are sensitive to, like maybe gluten, things can get worse and faster. It's true. But in this case, even people who don't drink have this condition, and usually men are more susceptible, but now I see a lot more women with it as well, more than ever. So they end up very self-conscious, and usually it's the wives who bring their husband because they're sick and tired of people telling them that they think that their husband have a drinking problem. So those wives are ecstatic to see the results of all of this superfluous tissue being eliminated, usually in one sitting, which does not even require anesthetics. does not require any cutting or knife or blood or bleeding. So there's no downtime except for the big scab that would occur for a few weeks. There is no suffering or bleeding, and it's very tolerable even during the treatment itself because it does not use any cauterization loops or burrs or other instruments that actually invade and cut off and slough off skin off your nose. There is, I think, a saying, right? No skin off my nose, or is it off my teeth? I know that there is something about skin off something, right? It is off the nose, right? So maybe it's related to Rhinophyma. We have to look at the etiology of that specific phrase. So it's pretty easy to do if you are thinking of the nose artistically and you know where it would have been, how the nose was shaped in the past. We need to bring it back to that shape. Sometimes the growth is in the bottom. And sometimes, in addition to the Rhinophyma, the patient has a skin cancer right on the nose in the same area. Or they may have had a surgery, like a plastic surgery in the past, as a result of which they have a linear vertical scar right in the center of the nose, or they had a surgery elsewhere and they have been disfigured. Then we can actually use the Rhinophyma to the patient's advantage. We can remove the Rhinophyma in an artistic fashion that makes the nose more symmetrical by removing more on the side that needs to have more removed and carving it artistically, which you cannot do surgically in that situation, because we're talking about different types of tissue. Scar tissue is not the same as Rhinophyma connective tissue and the growth of sebaceous glands. So if you are aware of what tissue you're treating, you can have a differential of the treatment to make sure that the patient gets the best cosmetic effect. So normally 95% of the surplus tissue can be eliminated in one sitting. And then on the second sitting, you can get rid of the remaining 5% or 4%. And then if people still want another round for further improvement, it's up to them. Most people are fine after once or twice. But if they want perfection, then on the third round, we can smooth things out as if we use a smooth, fine sandpaper at the end of the sculpturing. So this is basically a rhino sculpturing approach, which is unique to our method, to our skin method, and it deserves its own separate attention because vast majority of people who come in for skin lesions or even skin cancers are totally unaware of the Rhinophyma, and they are not happy about how their nose appears. They want something to improve, but they don't know how, so they never even mention it. But as soon as you tell them that they have Rhinophyma, you got their attention instantly because they love having a diagnosis. They love having a name to blame it on instead of the drinking or other issues that have to do with lifestyle and choices. This is something that fell upon them, supposedly, and they are happy to be informed. So every time you see a person who has a line right here, a horizontal line that divides a normal nose to the top, and the bottom is becoming bulbous and filling up initially on the sides, and later on the top, and later on the bottom here and inside, so the nostrils get narrower. Anytime you see that, and especially a telltale sign is the enlarged pores, very much enlarged. When you see that to people, immediately say, you know, you have a condition called Rhinophyma. It affects close to 50% of Caucasians by some studies. depending on the stage. Some people are in the early stage of it. They can wait 5 or 10 years before it becomes problematic, but it can be treated in any phase in conjunction with the clinical decision of the practitioner, whether or not it's something they want to engage in for everyone or not. So tell yourself the words Rhinophyma right now. I want to hear you say Rhinophyma. Very good. I didn't hear any of
Rhinophyma.
No, I saw your lips moving and I knew you were doing it right. So I was
Rhinophyma.
congratulating you because you moved your lips perfectly. So I knew that you were right. So that's the Rhinophyma that you can help a lot of people with. They will be so thankful that you actually managed to save them from this agony of looking at the mirror or having people talk behind their back. So that's what I wanted to say about Rhinophyma. Again, it's important to look at it also from a holistic perspective and address the autoimmunity and the nutritional components of it, there's a lot of good science about it. And it's important to remove toxicity in the skin and in the brain, which are contributing to the neurovascular component of Rhinophyma and other rosacea. And it's important to start working on brain health because it's a form of rosacea. Therefore, the brain is probably being affected as well. So it's a good time to start doing things, which I have a lot of things to share with you about recent certification seminars that I have taken that could really help you in all of these regards very elegantly in your own home. Things that you can all do to improve your brain health in an effective manner that is much greater than just small things like improving your diet a little bit or reducing your sugar intake. All of those things don't add as significant of an amount to your health, but there are things that you can do that add extremely significant improvement and preventative value that most people are not aware of. And those can be discussed in private consultation until we do a lecture about it, and then you will all be in the know. So there are at least 3 or 4 or 5 other lectures that we can do on some new information that people should become aware of because it can save their lives, it can prevent cancer, it can eliminate the risk of cancer recurrence, it can improve significantly issues with prostatic hypertrophy, and in a very quick and proven way, with something that is providing health for the entire body that you can do at home. So all of those things are for different lectures. But now that we've talked about Rhinophyma, I want to go to the next topic, which was the issue of Scar-Detox and Derma-Detox. So we'll start with the Scar-Detox, which is extremely common because almost everybody has been through a surgery at least once. And most people have had trauma of some type, cuts, abrasions, knives, accidents. So a lot of, actually almost every adult that I know, and even some children, already have scar tissue somewhere on their skin or deeper. So there are scar tissues that are not very deep, that were formed because of an accident or a bad scrape or a bad wound. And then there are scars that are surgical. Surgical scars are usually a lot deeper because they are done intentionally, either to remove things in the skin with a wide margin so that it has to be a deep incision, or because the scar has to represent a surgery that was done for deeper organs. internal organs or inside the abdomen, or in the joints where you have to do a surgery, like an orthopedic repair of the shoulder joint or the knee or the hip. A lot of plastic surgeries result in a lot of scarring, especially the tucks, different types of tucks. Skin tucks will result in extensive scarring. And we have to ask ourselves, what does it mean to have scar tissue? And we need to understand the pathophysiology of scarring, what's inside the scar, and how it functions physiologically. It's not an entity that's inert. A scar has chronic inflammation within it. Listen to that carefully. Chronic inflammation always occurs within scar tissue. That's partially because scar tissue has interrupted circulation, which leads to uneven and imbalanced immunity. The imbalanced immunity and leakage from the existing blood vessels, which grow as a result of the inflammation, they grow aberrantly, many times in a stagnating fashion that leads to microclots. So scar tissue could have microclots within it. And the inflammation that is chronic is enhanced further by the inability of the scar to remove toxins through the lymphatics, which are blocked in the actual scar itself. So this interruption in the normal activity of the skin makes us susceptible to chronic hypertrophy of cells within the scar, and the inflammation also increases the likelihood of developing cancer within scar tissue. Now, there are quite a few scientific studies. If you look at PubMed, you will find very interesting descriptions of appearances of cancer within scar tissue, whether it's on the skin or anywhere else in the body. But the skin is obviously the most common to have scars in, and that's why we have to pay attention. And if the scar appears to be a little red or a little itchy or causing a little pain, then it's being active. Sometimes it's more active than other times. This activity will potentially increase the risk of forming a cancer even more, because it could lead to hypertrophic scars and even to keloids. And studies were done with those, showing that they have days that are more itchy, more inflamed, and days that they are a little better. That depends on what you eat, what toxicity you've been exposed to, what the scar has been attached to or touching, what type of toxins have come into the scar because of proximity, like clothing, using synthetic clothes, and so forth, or putting in unnatural bands or rubber or other toxic agents. Somebody is doing a very interesting thing in one of the pictures of you. So I'm really interested what she's doing. It looks like she's trying to pull a snake from the ceiling in her house. So I'm a little distracted by that because I wonder what it is that you're doing. It's very interesting. You don't have to answer, but you can write it in the chat later, because I've been mesmerized by your activity with that long tube. It looks like you are a firefighter. So thank you. Anyway, so it's interesting to see people in their living room as opposed to sitting in an audience where you can see everybody and people behave a little better. But some of you have been picking your noses and all kind of things that you feel comfortable doing in your own living room. And some of you have been doing things I cannot mention. So anyway, because it will not, it will not stay on YouTube. At any rate, scar tissue is very important to pay attention to. I have known quite a lot of people who developed cancer within their scars, even deep cancer that ended up lethal. But the vast majority of people who have scars are those who had surgery for skin lesions and surgeries for skin cancers. And those people almost always, within a short time, up to a few years, will develop cancer right near the seam of the previous surgery. Sometimes it's because of the scar itself being susceptible and inflamed, but sometimes it's very different. Sometimes there was a little cancer that was forming in the skin. They did a biopsy and scraped the cancer cells deeper into the skin, like scooping it deeper and then out. That creates much, much deeper cancer cells in the tissue. And then when they do a surgery, they don't always remove the whole thing with those new cells that have been dragged deeper. And now they stitch the skin above that cancerous cells, and they have nowhere to go. So in those cases, the scar prevents the cancer for quite a while from getting up and out and to a visible state where we can do something about it. It's hidden under the scar. And it takes a while until finally we see it. Unfortunately, a lot of time, this kind of neglect takes place for years and years until finally the cancer has grown so much that it becomes visible and there is suddenly a sore that won't heal. In many of those cases, after 5 or 10 years of neglect, there will be a whole big necrotic fluid-filled, debris-filled, inflammatory waste material, all in a big chamber where the cancer has eaten the connective tissue and went deeper and deeper while nobody could notice it from the surface. So that is another problem with scar, that often it hides things that could happen underneath. Plus, because cancer has a harder time growing through scar unless it's developing within it, because it's having a harder time, it will elect to grow faster in the direction of least resistance. So it could create fistulas, canals, tunnels under the skin while it's eating up connective tissue and muscle tissue and doing a lot of damage and disfigurement before we even notice it. And then by the time we do notice it and we treat it, we have to eliminate all of that chamber and tunnels and fistulas in addition to the skin above them in order to completely eliminate the cancer so that it can finally heal with a reasonable scar tissue without recurrence of the cancer. But this is something we do, and I have to do it on a regular basis with people after they did surgeries and have those scar tissues. But I'd rather they didn't have to go through that. I've had hundreds of patients with that type of condition just in the last 5 years, and they're pretty happy with the results. Their scar is reasonable, it's not too grotesque, and we can always go back and improve the scar and smooth it out. But if it's deep to begin with because of the surgery, we cannot eliminate it. All we can do is a process called Scar-Detox. So Scar-Detox is basically trying to reduce the inflammation, reduce the risk of cancer, improve the circulation, remove the microclots, improve the lymphatic drainage, reduce the stasis and stagnation. And by doing all of that, we also reduce the hypertrophy, so the scar becomes smoother, less visible. And the end result is that the tissue that is scar tissue, which is very fibrous, becomes more vitalized. Now, you might ask me, why would scar tissue form? wouldn't it be a mistake in evolution for the body to create something that would predispose us to cancer? And the answer is, whenever in nature we get injured enough to end up with a scar, that type of an injury or an interruption of the skin requires a lot of energy to heal. And the body wants to heal it as fast as possible so that we don't get infected or that we won't get injured any further or show our weakness to some animal that will smell the blood and come after us. There's a major advantage in nature to healing those open wounds as quickly as possible. But because it's a highly energy consuming process, the body takes a shortcut and puts in there a lot of connective and fibrous tissue that is not as good as the original. And because of that, we end up with all of those effects that I mentioned. So we basically, for long-term benefit, we sacrifice something in the short term, but because in nature, long-term could be 5 years, 3 years, 2 years is long-term in nature, enough to make another child or two. But for us, who are accustomed to expecting longevity, the cancer is no longer giving us the long-term advantage that we are looking for. It's too long because we will almost definitely develop a problem within the scar tissue. So we need to revitalize that scar. And the more often we do it, the better off we are. If we can do it twice a year, would be great. Even once a year is better than nothing. So look at your own body, find out where your scar tissue is, and whether it's on your face or on your belly or your back, we need to do something about it to reduce the risk, sometimes for appearance sake as well. And what we use for that is special magnetic needles that have no sharp edge, meaning these are not needles that you can stick into the skin, but they are very, very small, and there are many of them together. So it looks like a pencil, the edge of a pencil, like a graphite pencil, but that end may contain 52 or 88 or 132 tiny needles that are very, very strongly magnetized. So when you run those needles over the scar, you feel a little bit of an abrasion, like dermabrasion, but this abrasion is very tolerable. You don't need any anesthetics for that. And you're using liquid compound that is proprietary that creates a magnetic pole within the organic toxic molecules that are residing within the scar. In addition to that, we know that scar tissue will contain other toxins like heavy metals that the scar is more likely to absorb because it's loose connective tissue and it doesn't have a healthy stratum corneum, a layer, the fatty layer on top of the skin that helps protect us from a lot of toxic elements in nature. So we remove at the same time, using those magnetic needles, those toxins and those heavy metals and those organic matter, organic toxic molecules that are in the outer layer of the scar. And we pull it out. And when we actually swipe on it with a little gauze pad, you will actually see the toxin that we got out of your scar. And you will see, after a couple of weeks of healing time and a few microscabbing, that the scar is less inflamed, much smoother, much less irritated or itching, less hypertrophied, and more revitalized. So the scar becomes more vital, like healthier skin. And because it's not ever going to be 100% revitalized, you may need to repeat it once in a while, especially in parts of your body where you care more about potential outcome. So this is the issue of Scar-Detox. It's a new development that I'm adding to our armaments, many armaments of helping people address the dermatological issues of their body. And I hope that many of you will take advantage of the Scar-Detox, as well as the Derma-Detox, which is the next topic. So Derma-Detox has to do not with scar tissue, but with regular skin. Regular skin is actually a misnomer, because regular skin is what you would have if you never put anything on your skin. But most people put any out of numerous agents, anything from blush to mascara to foundation to concealer to makeup to creams, lotions, humectants, humidifier, so many types of products that people put on their skin and on their hair, and shampoos and soaps and conditioners, and different types of colorings. I mean, the list is endless. What people put on their body, and they take it for granted that it's okay because they think that Uncle Sam is protecting them. They don't realize that there is absolutely no regulation in that industry. And most of the regulation is self-regulation, which means we are trusting the big corporation to investigate the toxicity and carcinogenicity of the products that they sell us to put on our body. Just a little bit of science for your benefit. In studies that are reported by the industry itself, the manufacturers, only 14% of the product would be discovered to have some level of toxicity and carcinogenicity. Only 14%. But if you do the investigation through independent studies, it goes up to 75%. That's a huge spread. And that just shows you how little you can trust whatever people are selling you to put on your skin. Now, this can be slow and gradual cumulative damage. Now, I have a lot of information about that is worthy of an entire lecture on each one of these topics, on each one of these materials and products that you put on your body and what's inside them. What are the chemicals? Some are frank carcinogens, meaning that they are obvious carcinogens, things like fluoride, which we all are exposed to in our skin if we take regular shower in fluoridated areas, or chlorine, different chlorinated substances, formaldehyde, and so on. Many preservatives, many things that we even put in our body through the mouth. If you can do it orally, it doesn't mean that you are healthy doing it on the skin. There are different types of absorption, and things that are fat-soluble toxins sometimes will more easily go in through the skin. And if you have a medical condition where the skin has been damaged, let's say rosacea, if you have rosacea that we talked about earlier, you will always have dry and brittle skin, and your transepidermal water loss will be increased, meaning the integrity of the stratum corneum will be lost, and you'll be continuously losing liquid from your skin. Your living epidermis will be ever decreasing in its quantity of water within it. And we can measure that. I have the instruments to measure that in people, as well as an instrument to measure the level of liquid within your living epidermis. And if you do all that, you realize that what you put on your skin can easily end up deep in your dermis. And then once it's accumulating in the dermis, it can slowly ooze with the lymphatics into your circulation. But the majority of it will still be in the dermis because the dermis already has its own immune system. Those antigen-presenting cells and macrophages of the skin, they're called Langerhans cells. They're coming to the rescue. They sense the toxins coming in just like people with tattoo. And you know that tattoo increases the risk of skin cancer right in the area of the tattoo because you lose the immunity in that area. You have all those dead macrophages that are full with the toxic pigment of the tattoo, and they stay within your dermis for the rest of your life. Now, they get very, very slowly faded over time. What does it mean? It means that some new macrophages are coming and they're not killing, they are lysing. They're breaking down the macrophages that sacrificed themselves originally. And that's why gradually the pigment of the tattoo is fading. That proves to you that the dermis will contain and maintain a large quantity of those toxins. And what will that lead to? Premature aging, cracking, dryness, shrinkage, and loss of lustrousness. The skin becomes dry and appearing more zombie-like, more prematurely aged, and then people feel obligated to cover it with more crap because they want to hide the damage from the previous crap that they put on it. And it ends up a vicious cycle that makes it worse and worse until people start looking like those three ladies in that movie where they lived forever. You've seen that movie with Goldie Hawn? They lived forever, but their skin started looking like it was nothing more than a cracking plaster. And that's what we're seeing in a lot of people today because all they do is put blush and concealers and other things on their face all the freaking time. Every day. Think about it. And some people do it 3 times a day. Every time they go out, every time they leave the bathroom, they have to add a little more. So there's almost no such thing as normal skin anymore because all of us have been exposed to soap, to shampoo, to conditioners until we learned we do too many showers, hot showers, until we learn that nature does not want us to do that and that cleanliness is not godliness. Because it's a matter of how we define cleanliness. And we need the microbiome of the skin to protect us. And we destroy it every time we use soap. And we destroy it every time we use oil, even if it's edible oil. So nobody's skin is healthy anymore. The damage is cumulative. And then we put those creams and lipstick and chapsticks and lip gloss. And then we wonder, why is it that so many women, more so than men, although men are using chapstick quite a lot, why is it that over time, our lips seem to get thinner and thinner and thinner and drier and older looking and no longer naturally glossy by comparison to when we were kids? We put so much stuff on the skin of the lip that it accumulates all those toxins which interrupt the metabolism of the cells, and the replication becomes aberrant and insufficient, and they start creating cracks and they shrink, and then people feel like they need to save themselves with injection into the lips, right, to puff them up again. Of course, they're not addressing the underlying issue, and they're still putting lipsticks and gloss on top of that to show off their newly luscious, puffed up lips. So I see a lot of those things in these influencers events, which should really be called the Silicon Valley not like your Silicon Valley, but a different kind of Silicon Valley, or maybe Silicon Mountains, if you will. Silicon Hills, how about that? So you see how all of these toxins in the skin devitalize the skin and increase the risk of developing skin conditions of any type, from acne to dermatitis to different types of eczema, all the way to seborrheic dermatitis and even more significant skin condition, even autoimmune conditions of the skin like psoriasis. So all of that is one thing, but then let's not forget the cancer, because many of those products contain carcinogens. Now, don't tell me that you trust the company that you use because you have done your research. You're looking on the internet, and some companies with great intention will tell you that everything is organic, that they sell you, that everything is edible and nothing more than just food stuff. But even they don't know where they source their ingredients from, because they come from India or from Pakistan or from other country where the manufacturer is doing whatever they do to survive and cut corners. It ends up in your organic and natural product, and nobody really knows for sure. And even if you made something at your own home from natural products that you find in your own kitchen, if the oiliness of it or if the pH of it are very different from the skins, you will destroy the microbiome, you will destroy the stratum corneum, you will dilute the natural oils of the skin, which include ceramides and sebaceous liquid and free fatty acids and membranous lipids from the cell membranes that ended up in the oily layer of the skin. All of that is designed to be at the perfect pH and the perfect solubility to protect our inner skin and our dermis, so that it can do its many, many jobs of creating hundreds of nutrients for the rest of our body, just like the liver does. And all we're doing is we're poisoning it every day with those products. So if you are doing some kind of an anti-aging routine with product that you put on your face, just so that your face looks a bit younger, remember that in the places in the world where people live the longest and are the healthiest, the blue zones, everybody is scrawny and wrinkly. But they live really long and they're happy and they're strong and they're active in society, but they don't have huge muscles like some of those people who compete for longevity races on the internet to become big influencers. And nobody in nature and in those blue zones tries to continuously use makeup to avoid showing off their wrinkles. So all of that is not necessary, but if you take good care of your skin from the inside out with the appropriate nutrients and nutrition, and you don't put anything toxic on it, it will gradually heal. You can actually reverse the aging of the skin with natural agents, different natural agents like photobiomodulation is one type. Moderate sun exposure is another type. If you do it the right way, you actually increase the longevity of your skin and improve your transepidermal water loss, meaning improving the integrity of the stratum corneum. All that can easily be done. And if you want to go a step further and put something on your skin to create photodynamic therapy by activating certain products that are designed to interact with the right frequency of light to have greater physiological benefit, activating the mitochondria in the skin and other things, then use it only once a week, rapidly, for a specific treatment. So call it a treatment and not a makeup. So if you do it once a week or twice a week at your own home, which I'd like you to learn how to do these things, for those people who have the time and those who don't have a good history of taking good care of their skin up to this point, then we can teach you how to do that so that you can take better care of yourself. But remember, that would only be once or twice a week where you put something on yourself for specific therapeutic benefit, and then you put nothing on your skin the rest of the week, allowing it to heal and to become healthier. But what do we do about all those toxins that have accumulated all right on your cheek because of the blush, right on your forehead and chin because of your concealers and foundation, right on your lips? We want to make them lush again, luscious and more healthy looking, more vital. So that's when we use the same magnetic needles with the same component and the same product to abrase the lips or abrase the cheeks or the brow or the nose, wherever it is that you put the most amount of toxins over the years. And we can pull those toxins out of the dermis, just like we can pull out tattoos. And with this approach, we can remove actual tattoos. But that takes more time and repetitious treatment, maybe 5 or 6 sessions or 3 sessions or 10, depending on the type of tattoo. It's, nobody can promise in advance because there are many types of tattoo pigments and the depth is different from one person to another. But you can actually remove those toxins that accumulate in the skin or in the lips in the same way that you can remove tattoos in just 1 session or 2 sessions, once every few months or every 6 months. By doing that, you will see your lips becoming plumper again and less toxic. So this is something that you might say is cosmetic, and it largely is, but let's face it, most people are going to care about their face, or they will not want to face it. So in order for people to want to face themselves, we need to do something about their face. And if we remove those toxins, we can also give you a medical benefit of reducing the likelihood of developing skin cancer on the face. Have you ever wondered why is it that people develop so much cancer on their face? People will always blame the sun. Always, because it's easier not to take responsibility. But I'm in the sun every day for hours, and my skin is not giving me any trouble. So it cannot just be the sun. It has to do mostly with the toxins. And maybe the sun combined with those toxins creates a perfect storm of excessive free radical damage and excessive mitochondrial damage, and leading to premature aging of the skin. So when we do the derma-detox, which normally people will do on their face, as opposed to the Scar-Detox, which people would do anywhere they have a scar, that would make a big difference, not just in the appearance of the skin, but in bringing you one step further towards the independence from using all of these toxic compounds day in and day out on your face, which leads to all of these skin conditions on the face as well as cancer. Okay, this is the Scar-Detox and Derma-Detox. Normally, those treatments take up to half an hour based on the specific area of treatment. If people have a very large area, then it will be 2. So doing both cheeks will be 2 areas. The lips is 1 area. So the same size of both lips can be extrapolated to other parts, and then you know how many areas are how much time will be required. So the lips alone will be, let's say, 20-25 minutes, but doing the whole forehead will be equivalent to 2 areas. So that's important in terms of scheduling. And I bring with me, hopefully, to most clinics, a master esthetician that has been trained in doing this with some of my modifications for the Scar-Detox and Derma-Detox, which are further development of my work on top of some work done by another person who was mostly interested in tattoo removal. I'm less interested in tattoo removal only because it requires too much time and repetition, A, and B, most people who want to remove their tattoos just want to put a new tattoo instead. So why would I bother to, to give them an excuse to poison themselves even further and to make the old tattoo go even deeper? So it's really unconscionable, especially after I've seen so many melanomas or pre-melanomas developing within an area that has a big tattoo. So be careful with tattoos, and if you see people that have tattoos, quickly look at their tattoo area and make sure that there are no tiny dark spots within the tattoo or in its nearby vicinity, since that is going to be impacted by the toxins of the tattoo itself and the insufficient immune system that is present over there. So the next topic that I wanted to cover was metastatic skin carcinoma and turbo cancers of the skin. So turbo cancer is a recent term. If you look it up on the literature, in the last 3 years, we're starting to see a plethora of turbo cancers that many pathologists are writing about. They are finding cancers that grew really, really fast, that never would grow that fast. Remember what I said about the necrotic chamber underneath the skin? I mentioned it in relationship to scar tissue, but any type of neglect could lead to those occurring within 5 to 10 years. But now I've seen several cases already, just in the last 2 years, of people who developed these necrotic chambers, meaning advanced carcinoma, within 3 to 4 months instead of 5 to 10 years. So that's a type of turbo cancer which appears on the skin. Of course, we see turbo cancers of the brain. We see turbo cancers of the liver, of the lungs, of the pancreas, of the colorectal mucosa, etc. Cancer of the breast, of the uterus, in reproductive organs, prostate. We see turbo cancers everywhere nowadays, and it has to do with immune suppression. Our immune system has been damaged and suppressed, especially in recent times, because of certain very common agents that people have treated themselves with, thinking that they are helping themselves, but actually unknowingly causing effects that were never studied initially for lengthy amount of time. And a lot of people already are paying the price for that, and that's what we call turbo cancer. So now, for the first time in the history of medical science, we actually see that even basal cell carcinomas, the skin cancer that would never metastasize, that would only be causing local disfigurement as they eat up tissue under the skin if we neglect them long enough, or if we cover them with scar tissue, or if we poisoned our skin too much and too deep, allowing the cancer to form deep within the skin so that it could form these necrotic chambers before it gets outside, before we can actually notice it on the surface, on the epidermis. In all of these situations, we don't see metastasis. But nowadays, for the first time ever, we do see metastasis of basal cell carcinoma, which can only be attributed to this dramatic suppression of the immune system that has taken place just in the last 4 years. We know about some of the mechanisms of this suppression, like, for example, disabled natural killer cells. But I don't want to get into more of that because it would require getting into more detail than this lecture is supposed to contain, plus it might be unpalatable to certain entities. So I'm not going to go further into that discussion, but I think most of you understand what I'm talking about. So these issues of turbo cancers of the skin and metastatic carcinoma of the skin mean that we have to behave differently. We have to take those carcinomas a little more seriously than we used to. In the past, professors of dermatology would tell us, and that's documented in the scientific literature, that carcinomas of the skin are not real cancers, because normally they cannot metastasize or kill anyone. They just disfigure us locally. We know that squamous cell carcinomas are different because even though they would never metastasize, if you biopsy them and introduce their cells much deeper, then you could theoretically cause metastasis with squamous cell carcinoma. But generally speaking, if you did not take anti-organ transplant rejection drugs, the immune system will not be so suppressed that you will develop metastasis as a result of a skin carcinoma. Today, the immune system is so suppressed even if you don't take such drugs. So maybe a lot of people now can have organ transplant and the immune system will not be strong enough to reject their organs. You know, that would be a good thing, right? If you are standing in line for an organ transplant surgery. Most of us don't. But because we have been exposed to the last 5 years or 4 years, a lot of people have suppressed immune system, and it's just a matter of time if they don't take precautions. It's just a matter of time before an increasing number on a bell-shaped curve will end up with some types of problem related to suppressed immune system, which now we see with the basal cell carcinomas that can metastasize for the first time. So pay attention to those. Look at any skin abnormality and don't delay too much. You know, don't neglect your skin too long. Don't think, oh, it's just a little, you know, a little scab that I'm sloughing off every other day or every few weeks. Or it's just a little rough spot. It will go away. It's meaningless. Or some of you will say it's only actinic keratosis, and you might be right. But even actinic keratosis can quickly convert in the presence of suppressed immune system, and portions of it will become cancerous. And it's very easy to see that during our treatment. When we treat all of those carcinomas, or pre-carcinomas, whatever you want to call them, you can very easily see which part of the lesion, which might have been characterized as actinic keratosis, we can tell rapidly which areas are still actinic keratosis and which areas have become already more progressed into a carcinomatous state just by looking at the response of the skin to the treatment. So it's a dynamic process of treating and observing, and the treatment then continuously gets modified based on what we see. In the result, of the skin as it responds to the liquid formula that we apply on top of the lesion. And many times it's surprising to people how even a very new actinic keratosis has already started to convert. That's also a sign of immune suppression. So we need to be more proactive about it instead of waiting like we used to when we were not worried about basal cell carcinoma or even about squamous cell carcinoma, so long as we didn't have a biopsy, of course. If you had a biopsy, you have reasons to worry. And of course, if you have suppressed immune system, you might want to engage in some therapies that would boost the immune functionality, like using the Rigvir, the Rigavirus, which is an ECO7 virus isolated from the gastrointestinal tract of children. It's a healthy, non-genetically modified virus that has no side effects, and you can take it preemptively to not allow cancer to grow any further or metastasize by doing a search and destroy on cancer cells. So this virus finds cancer cells, searches for them. It's oncotropic, which means it's chemically attracted to cancer cells. It likes them. The more aggressive they are, the more it likes them, because it can use them to manufacture its own DNA and causes them to undergo apoptosis. So that's what we want, the cancer to go away. And also the virus will tag the cancer cells for the immune system to find it. So if you have a weaker immune system, at least it will have a better chance of going after the cancer cells, because most of the time cancer cells know how to hide from the immune system. So cancer cells secrete enzymes. Those enzymes are designed to break down the collagen so the cancer can keep growing. And there are some nutrients that we can take, some supplements that we can do, which I will not mention, that can actually help prevent those enzymes from breaking down the connective tissue surrounding the cancer, such that the cancer remains stuck in its capsule and it will not be able to grow as much. So there are things that we can do to protect people who have done the biopsy, or to protect people who already realize that their immune system is suppressed, so that they can overcome that risk. And instead of doing risk management, which is what the industries of toxins is doing, they always manage risks, right? Like in the cosmetics industry, how do they manage risk? By hiring a lot of scientists, an organization that pays scientists to measure the amount of risk from using those products and telling you that this is risk management. But risk management is not nearly as good as risk reduction. We want to reduce the risk, if not eliminate it. We don't want to just do risk management. So in this situation with our health, we need to go a step beyond risk management and be a little more proactive in the face of this ever-increasing social immune disturbance, which manifests in all of those new autoimmune diseases that we see even in children that develop Rhinophyma, as I reported to you earlier. All of these things are critical, and that is really an interesting age, an interesting epoch to live in, to see all of these things accelerate, which reminds me of that movie, Age, that movie by this famous Hollywood director, where humans are going to a beach where the condition of the beach accelerates people aging dramatically. So they die within a week instead of 50 years. But they go through all the process of aging in a rapid way. So some drug company is doing research on those people on the beach to see what drugs they can give them by accelerating. Instead of doing long-term longitudinal studies for 40 years, they can do a study in seven days, right? So we are now living on that beach. Only it's not as bad yet, but it's definitely accelerated. And that's why we see a reduction in our lifespan taking place now, especially in young people and children. There's a much higher death mortality rate now, cutting short the lifespan of many children and teenagers. We have to ask ourselves what has happened that is doing that, and we need to protect our loved ones and protect ourselves and support our immune system with anything that you can to reduce the risk. And there are some new and exciting things that you can do, like I said earlier, that can dramatically reduce the risk of cancer in susceptible people by maybe 50 to 80%. And these are pretty simple things. So contact us about it, and I'll give you some information about it for free. Maybe I'll make a little, I'll write a little paragraph or something of a few things that you can do to benefit right away and protect yourself. The last topic I want to cover today is mucosal and genital dermomucosal penetration and lesions, lateral subdermal spread, fistula formation. Okay, I already mentioned some of those things, but I'll just go more into the mucus areas because these areas are also of concern. When the immune system is suppressed, we see more fungal growth and leukoplakia in mucous membranes. And I've seen more of it recently. I've seen quite a lot over the years, but recently I see more and more young people in their teens, 20s, who are developing conditions of the mucous membranes. And those can easily become cancers. So a lot of women are developing unusual local superficial lesions around their vulvar area, so around the vagina, or in general in the crotch region. And they might have an itch or a burn or a pain, and it's pretty superficial, and they don't know what to do about it, and they go to gynecologists who often look and can't see anything because it's still in an early phase and it's growing deeper than the mucosal layer that is visible. And only by finding out exactly where it is and removing a thin layer non-invasively, you can expose an area underneath that is multiplying that might end up as a cancer in the vulvar area, vulvovaginal cancer. It's becoming also more rampant today, and it's also a type of a turbo cancer because one of the results of immune suppression is different viruses that normally are dormant may actually have a party at our expense. They can flourish in the face of insufficient immunity, and we start having all those HPV viruses, for example, which normally might be dormant, we might not even see them, but now we start having warts or wart lookalikes, and I see a lot of them in practice. A lot of women and men come with growths in an anal area, in the vaginal area, and they don't like the idea of surgery or liquid nitrogen because it's very painful and it doesn't get to the root. But with our method, the material can easily penetrate through those and go all the way into the root. And very quickly, you can eliminate 100 or even 200 of these lesions in one person, and they will not come back. Maybe one or two that were not seen in the first round that were still microscopic will start growing, and they will come back. The patient will come back 6 months later or 3 months later with only two, but they had 200 before. And then you get rid of those two and they're done. And they didn't need anesthetizing. They didn't need any pain things. They didn't need any preparation. It's a very quick and easy thing to go through. And many times these HPV growths, those papillomas, might grow inside the vagina, where they will not be visible to an inspection by the gynecologist from the outside. So you can very easily use a speculum to actually visualize and remove things, not just from the introitus, the entry to the vagina, but also throughout the entire length of it. And there is a professor of gynecology and obstetrics in Israel, Professor Kaplan. He's the head of the association or the Academy of Obstetricians and Gynecologists in Israel. So he's really high up. And he's in his late 70s, so he's not worried about politics so much. So he's now working with me and with my material to treat cervical atypical cells or pre-cancer potentially risky lesions on the cervix. Dysplasia can be peeled off very easily using my material without using anesthetics, without the discomfort that is normally associated with this procedure. Of course, you need somebody with the right instrument if you're going into the cervix. But most lesions, especially if you have a positive pap smear, most of the time it's a wait and see. Watch and come back, and we'll see in a few months if it's still a problem. And then if it is, we'll do a colposcopy, which is very uncomfortable. And then, they put dye to see which areas are affected. And then they will actually do an actual scraping with a cone or with an instrument that is very uncomfortable. And oftentimes they need some type of sedation to feel more comfortable. All of that can easily be avoided simply by smearing the product on the right tissue in the right place based on the findings of the PAP or the finding of the colposcopy, if that was chosen and if that was done previously. And you can do the test again afterwards to see success. It's pretty simple. Do a before and do an after, so you have the proof. I like to have proof of a concept, just like we do with colorectal cancer. We have a proven concept because we have a marker to measure before and after in the stool, just like we look at the CRP in the stool as opposed to CRP in the blood. We need to see the CRP level in the stool because that tells us about non-specific inflammatory status in the digestive system, which is highly correlated with colorectal cancer. I've seen it hundreds of times, that people with high CRP in their poop have a very high likelihood of colorectal cancer, depends how long they had that inflammation. So we're looking for concepts that we can prove. And this is pretty easy. So anybody who's worried about developing something underneath the mucous membranes or within them, sometimes we can help them easily. Sometimes it's a bit too deep, especially if they've done biopsies, and then it's harder to get rid of it. You have to do multiple treatments in one sitting to go deep enough if it's a tumor on the tongue or underneath the tongue or on the cheeks. But the vast majority of people are extremely happy to have those lesions that they keep chewing on finally be gone. And only if it starts coming back, we might suspect that we need to do more. And then we will deal with that. But in the vast majority of cases, we can get rid of it simply by treating it based on the diagnosis. If it's something of risk, we treat it more. If it's something that looks like a benign lesion, like a growth on the tongue that has not changed for many years, just get rid of it like you do with a regular mole. And if you have a growth in the gut, don't just cut things out or snip them like you do with polyps, because you're creating inflammation and scar tissue, which leads to increased risk of colorectal cancer. There was a study that showed 2.8 time increase in risk. It's a study published. 2.8 times the risk of developing colorectal cancer after snipping a polyp in that area. Of course, those who wrote the study misinterpreted the results to show that this is a proof that this polyp was going to become cancer, and it's a good thing we removed it, even though the cancer occurred after they removed it. And now they'll have to go back again and remove a chunk of the colon, not just a polyp. All of that could have been avoided simply by testing for the right parameters, looking for the CRP and the histamine and the calprotectin and the zonulin and the EDX and the EPX and all those other parameters we look at in the stool in a test that we sent to Germany, plus the M2PK, of course, which tells us if you have colorectal cancer. And this is all in the scientific literature. It's all published. You just do the test and you save lives. Nowadays, 1 out of 3 people that I test are positive for colorectal cancer. Almost all of them have very high CRP to begin with. Those who have high CRP more recently still don't have a positive colorectal cancer test, but it's already inching up. It's already going up. It's already 2.5, 3, 3.5. It's getting closer to the danger zone, parallel to their CRP, but in slight delay. So get tested, be proactive. Proof of concept is always critical, whether it's mucous membranes or skin or gut or face or autoimmune condition. We have proof of concept. Nothing is 100%, and we can never make bombastic claims because of, well, there's always some cases that are arriving too late or having too advanced of a situation, or who are not willing to follow the instructions or to make the changes in their lifestyle. Some people refuse to go to the sun. Some people will refuse to take off and stop using all those chemicals. And GMO products, which are also in your, even GMO products are in a lot of your cosmetics. This is well known. I'm not talking right now about food, so it's okay. Cosmetics are allowed to have GMO products in them without announcing anything. It's okay. But all of those things that can be absorbed, we have to be proactive and take care of ourselves so that we are here to look at each other during another Zoom talk in 50 years from now, smiling at each other, looking healthy, looking young, looking vital, energetic, and non-toxic and revitalized. So thank you for your patience, and I'll take some questions right now. If you wrote questions in your notes,
I wrote down the questions they wrote, and people are raising their hands. So I'll probably gravitate to the hands that go up first. But before we do that, I've got some questions. What do you do for your beautiful skin? Does retina cream or the MitoPure or ASEA stuff work? And people want to know what stool test you were talking about. But your skin is fantastic. It radiates. What do you do?
Well, thank you. I use really good lamp. Just kidding. Uh, those lights that give you a little pink hue. um, Actually, I don't do anything. I don't put anything on my skin. That's first. So remember, you can damage your skin very easily by doing bad things to it. And if you don't do anything, your skin just doesn't get damaged. So it's much better not to do anything. Sometimes people try so hard that they cause harm. And then they invest so much in something that doesn't give them that much benefit. And they forget the important stuff that they could save a lot of money on. So do the important stuff first and don't poison yourself, okay? That's the most important thing. So I don't poison myself. I put nothing on my skin, never. I don't wash my face. I know that people have a routine, a ritual of, facial washing and going to have this and that and facial. I hope that there are no estheticians here that will be upset to hear that I don't do facials or anything of that nature, because I don't believe in putting anything on my skin. I protect it, and I don't use soap on my skin either. So you see how easy it is to do nothing? Don't even put soap on your skin. Don't eliminate, don't destroy your stratum corneum. Don't increase your transepidermal water loss. Okay? Maintain, preserve your living epidermis water content, and preserve that way also your elasticity. And also the diet. Avoid too much protein. When people eat so much protein, keto, paleo, all of those diets are forcing people to generate huge amount of nitrogen free radicals, which damage the proteins that are hygroscopic and keep the humidity and moisture within your skin. So if your diet is about making your muscles impressive, you're going to damage your skin because you will take a lot of protein powders and you will worry about where you're getting your protein instead of worrying how to avoid too much protein, which is the real problem. And then your skin will thank you and will maintain its stratum corneum's health. Also, I don't put oils of any type on my skin. And also I go to the sun every day if I can. Every day where the sun is out, my whole family goes out and we lie down naked at high noon and we enjoy the sun front and back. And that keeps our skin healthy and young. We don't burn, we don't stay too long, but we stay long enough to increase the activity of DNA polymerase, which protects our skin's DNA and reverses the early phase of skin cancer. So these are natural, easy things that we would do in nature without thinking. Okay, that's simple. Now there are other things like, in the bedroom, we inhale the bioactive plant fraction molecule, and we, those also go on the skin and they have a natural natural suppressive effect on pathological microbes that might occur on the skin. I don't think it's that significant for the skin, but it might protect the healthy microbes on the skin, and it's naturally absorbs into the natural oil of the skin instead of alter it, because these are tiny, tiny molecules. So they go through the skin and they might protect our skin inside and the dermis. They do have some support for detoxification in the liver. So if they support phase 1, phase 2 in the liver, they probably support phase 1 and phase 2 in the skin as well. Plus, the sun helps us manufacture all of those nutrients within the skin. So they support not just the rest of the body, but also the skin itself. So what do? I just follow nature, and it might take many phases how it's done, but you don't need to think about it much, and you don't need to spend much time in front of the mirror putting stuff on, and you don't need to spend a lot of time and money going to all kind of places that would basically sell you all their products to take home, which are mostly SPF creams, and SPF creams are toxic. They cause skin cancer because they cause an imbalanced photonic spectrum. The wrong frequencies are arriving to your skin, and the good ones don't arrive. So you end up with even more nitrogen-free radicals, especially peroxynitrate, within your skin, because you're not releasing your nitric oxide that you make thanks to the sun within the skin. It's not released to the circulation, which is what we need. We need it to be in the blood, not in the tissue, not in the brain. If it's in the skin and in the brain, we end up with dementia, with Alzheimer's, with neurological degeneration, and with prematurely aging skin. So I hope this kind of gives you just a little glance. Of course, there are some nutrients, and I do take a supplement for hair, skin, and nail. So I know that I'm covered on the specific nutrients, and I eat more sulfur in my diet, and I do test for heavy metals and other things like that. But if you can remove some of them with the appropriate products, you can improve the health of your skin as well. So it's mostly about eliminating the damage. It's not about doing things proactively to be more vital. But maybe one day I will do the lip detox, just to demonstrate, or the concept to the patients. Or maybe I will do, some cheek detox, just to restore my natural blush of my youthful years. Just joking, just joking. Okay. Anyway, so, but because I never used anything, I don't need to do a derma detox, but many of you probably do. Other question?
I have a
Andrea,
question. Yes, hello. Thank you, Dr. T. This has been amazing. I really appreciate your talk. I have 3 questions. The first one is, I have these like bruises on my legs, even though it causes no problem, and I'm a dancer and I'm very active and I'm healthy, but they diagnosed it as urethema nodosum, and I'm just curious what the cause of that is, and if I should do anything about it, or.
Well, if you're suffering from anything, you should do something about it. But this is a multifactorial condition. It's a metabolic problem, and it's something that needs to be addressed through a consultation, because we need to do a complete history, find out all the lab work that was done recently, see the summaries, medical summaries, any other diagnostics that were done, see the actual photos of the lesions, and understanding the timeline of the lesion, and doing some additional tests perhaps to really get a complete picture, because metabolic conditions are usually multi-etiology. They don't come from just one thing, but from a combination of things, a synergy, again, a form of a perfect storm that finally leads to a symptom, and then you think, oh, I have that skin condition, but it's not even a skin condition. It's a metabolic condition. It's much deeper, and you just happen to see it on the skin. In all likelihood, it's also present elsewhere in your body, but you cannot see it. So you think it's a skin issue, but it's not. So schedule a consultation, contact my assistant, Aussie, and she will help you with that. It's clinic@ecopolitan.com. Clinic@ecopolitan.com. It will be in your notes, I assume.
Okay,
Yes, other questions?
Can I just ask one other question? What do you think about Ultherapy, Viora, and Retin-A cream?
I already said what I think about creams in general. Now, some people, after damaging their skin for many decades, might do the Novadermy procedure, which is a procedure that I oversee. It's done in Tijuana, and in 10 days, your skin looks up to 10 or 15 years younger. It's not for everyone. If you do it, you have to dedicate all 10 days for that. And after that, you have a new skin, like a baby's butt, plump and much nicer without surgery. But it's not for the faint of heart,
What's it called?
Novadermy. It's on our website.
Okay.
Nova, N-O-V-A, Dermy,
Right.
D-E-R-M-Y. But after that procedure, some people do use Retin-A and so forth to keep their skin young looking. That's something that they do because they invested so much, and it's more important for them to look young for many more years rather than gradually start aging again. So some people do that, but I personally would not, because it has some negative effects on internal organs and metabolic aspects. It's toxic. So it's up to each person to decide for themselves what's most important for them, okay? Nobody should judge them for that, but they should just get informed and make the decision accordingly. There are many other products. I don't want to get into individual products because there are so many of them, and it could take forever. So if people have specifics, you can just send them, and we can have for example, yourself, you might need a consultation anyway. So then we can talk about specific things that you have been using and that you are interested in, and then we can really tailor the answer to you. Remember that there are also genetic polymorphisms, and not everybody responds the same way. Right now, I'm doing a genetic test, a new one that is not expensive, that comes with very nice reports, called the SNP Nutrigenomics. And there's a discount for people who are doing it through us, through Ecopolitan. So again, you can contact Ossie if you want. We're looking for 103 SNPs, out of which 20 are directly affecting skin's health and longevity and skin's usefulness. So you can easily get there a more comprehensive report that is specific to you and what you can do about those findings epigenetically to reduce the genomic predisposition. Remember that genetics are not as important as people think. They're only important when you do a lot of bad things. That's when you are actually forcing your body to manifest its weaknesses. If you don't do bad things and you follow nature, most of your genetic problems will not manifest. You will not even know that you had them. And that's why some people who are exposed to a mild toxin develop cancer, let's say hormonal cancer, breast cancer, endometrial cancer, at age 30, and others with the same gene, with the same genetics for that specific condition, develop it at age 80 or never, with exactly the same genomic configuration for that disease. That's because they didn't predispose themselves further through an inappropriate dietary or supplements. A lot of time people take inappropriate supplements, like collagen powder, for example. So they do all those things that there are always some talking heads who will tell you to do those things, which end up in the pocket of some salesperson. Remember that the collagen powder industry was basically nothing more than the end result, the leftover of the animal rendering industry. And it was used mostly for dog food and cat food, until they found an ingenious way to make 100 times more money out of it by selling it to humans. So what do you think will happen with your toxicity level over years of using such products? Just think about it, okay? So people who do that and poison themselves and get all those hormone mimickers, hormone disruptors, and toxins that are directly affecting your hormonal functionality and your ability to process your estrogen, what do you think will happen to them if they have those genomic susceptibility? They will be the first one to show that they have that genome. So it's not that important if you do everything right. But since most people don't, it's a good idea for you to indeed get this test done. It's only $295, something like that. Pretty cheap if you do it through us. And you'll be supporting our humanitarian project in 3 continents. Plus, you will be saving a little money too. So that will just give you a blueprint. But remember, it's not that important if you live a really healthy lifestyle, okay? And even if you do, it will be more important to see what's happening in your body today with regards to your heavy metal toxic elements, insufficient minerals, trace elements, things like that. Deficiencies lead to disease rapidly. And excess of toxicity can also lead to disease cumulatively. So those are more important to find out. And inflammation in the gut is very important to find out because it's interfering with your entire immune system. And your whole body can become inflamed and predisposed to cancer anywhere in the body, including the skin. Therefore, everybody should do the stool test. Everybody, without exception. I do it myself once a year or once every 2 years. Even though I live pretty healthy lifestyle, I still want to test to see if I'm starting to inch towards the colorectal cancer, just to inch a little bit. And then I might actually do what I tell my patients to do. But I don't really have to do it myself. You know, they have to do more because they already have greater inflammation.
Is this the MP2K test?
M2PK, yeah, it's a part of my panel. But don't make the terrible mistake of only doing the M2PK. If you do, you missed everything I just said. The M2PK has to be a part of the whole panel, because if you do the M2PK alone and it comes negative, how do I know your CRP level in the stool? How do I know if you are getting close to start helping you prevent and eliminate the risk? How do I know what's going on with your histaminosis so I can tell you what to do to reduce the excessive amount of histamine from which at least 50% of the population suffer? Right now, from my testing, if I look at both histaminosis type 1 and histaminosis type 2, which you can only find out if you do the full panel in Germany, there are no panels in the US that will show you that, then I can say with great concern that at least 60% of my patients today that I test have one of the two, either histaminosis type 1 or type 2. Don't you want to know that? So don't make that terrible mistake of thinking, oh, I'm saving money, I'm just doing the M2PK. You're going to finally regret it, because when you have the consultation, you will be told, even if it's positive and you have colorectal cancer early phase, you'll still need to go back and do the whole panel because we needed to know how to treat you. You understand?
Yes, thank you.
You're very welcome. Other question?
Nichols.
Are you going to? Okay, I thought you're talking about, you're trying to nickel and dime me to death?
Yes.
Okay. So nickel.
Yeah,
Yes, nickel is toxic for a lot of people. It's in a lot of jewelry, and you
No,
can
that's
see.
the person asking the next question.
trying to
Okay.
ask. Okay, here's a situation.
Okay.
Left side of face paralyzed from Bell's palsy. Eyelid is drooping. Nobody wants to really cut in and do surgery because of scars and everything. And it's not for appearance. If the eyelid starts to droop so much, of course, there's no nerve. The eye can close, but the lid is starting to get lower and lower, baggy, and the right eye is not so bad. This is an elderly person. But if the eyelid starts to get so low, and okay, what's the solution but to cut and to pull that thing up? And it's not, again, for appearances, it's just to get that out of the way. But of course,
Let's
that-
try to accelerate the question because people are, we cannot do a whole medical history here, but maybe I can answer already from what I heard so far.
if you feel you have to do it, then what do you do if you've got no choice? But what else? What
Okay.
else?
No, yeah, I understand the question. Before you can answer a question like what's the solution, you have to ask what's the cause. And you don't tell me anything about the cause. So the solution is to have a consultation where I can find out what the cause is, learn about all the potential predisposing factors that are playing together in this picture that ends up with a neurological symptom. Neurological symptom can be from viruses, from other types of infection, from other sources of inflammation, from toxicity. There are so many things. It could be even from compression of a space-occupying mass that could lead to compression of the nerves that makes them allow the eyelid to droop. So all of those things need to be looked at, and if we can figure out a potential cause, then we treat the cause. Once you do a surgery, that's irreversible. You're going to have scar tissue in, the eyelid will not blink normally anymore. So it depends on how many years the person has suffered from that. If it's for many years, then you need to ask yourself some questions about that too. Sometimes a surgery is necessary if it's been there for so much time that a nerve has died. But obviously, we need to look at the MRI. We need to see different things that were done. And without looking at all this data, any practitioner will be at a great disadvantage and will not be considered a serious practitioner if they simply start giving you answers or solution without knowing what they're dealing with and what they're treating. I hope that that's sufficient, and I'll be happy to do a consultation by phone and try to figure things out. And if I don't think that there is a solution that can be manifesting within a few months of treatment, I would be the first one to say, in this case, you need to go to a good plastic surgeon, and I will personally refer you to one that I know and that I trust. So, it's not about rules and being excessively conservative or excessively dogmatic. Sometimes a surgery is necessary, and I'll be the first one to refer people when I feel it's in their best interest. Yes, other question?
Lilia.
Hi. I want to ask about brown spots on the face, how to protect from them. And is it organic sunscreen or hat? And then when they come back after treatment, maybe some deeper treatment needed. How expensive is it or not?
Well, first, the cause of these dark spots is accumulation of lipofuscin. Lipofuscin is cellular debris associated with nervous tissue, including the nervous tissue in the skin. We know that the skin and the brain are intimately connected to each other. They come from the same embryonic tissue during our years, during our months in the uterus, when we just are in the first phase of embryogenesis. So anything that's affecting the skin that looks like dark spots is also affecting your brain at the same time, which means that the same free radical damage, inflammatory debris, the same toxicity or metabolic issues or infectious agents that are causing accumulation of damage with insufficient protection ultimately cause these brown spots to occur. The operative word was insufficient protection. We all are exposed to certain things. We cannot avoid it because our environment is polluted. Our air contains toxins. Our water and our food, as you know, contain lots of toxins. Then we have all the drugs that are 10,000 times more toxic than the worst food that you eat in terms of the amount of poisoning that's taking place in your tissue. So you are losing your own natural protection, and the skin is showing it to you first, but it's happening inside your body too. So you're concerned about your skin, but I suggest to be concerned about your brain and the rest of your body and do what it takes to correct that. It just so happened that an area on the upper cheek or right under the eye, because of its circulation and because of its thinness over the years, it gets thinner and thinner as your skin gets more and more damaged and less plump, then it will manifest sooner. And that's why you see it there first, okay? So you're asking me if you use organic sun protection factor, it's like you didn't listen to the lecture when I said that SPF creams cause damage. So, if you put an SPF cream, you're going to stay in the sun 30 times longer before you realize it's time to get out because it's SPF 30. So you stay 30 times. Most of the energy that comes to our skin from the sun is infrared. Infrared is a lot of energy and it penetrates into the dermis. If you have too much uncontrolled infrared, that energy will age your skin and cause free radical damage and mitochondrial damage, which would lead to debris coming during oxidative phosphorylation in the mitochondria, resulting in lipofuscin accumulation in the skin. So the SPF is forcing you, besides the poison that are present within the product itself, it forces you to be exposed to a huge amount of solar energy that in nature you would do 5-10 minutes and you say, oh, I feel like it's too hot, I need to go in the shade, or put a hat on. You'd be protected. But with the SPF cream, you lost that protection because you think everything is fine. You don't feel the UV, which is blocked by the SPF. The UV is designed to tell you you've been here too much. The UV is your warning system. You need to expose yourself to the UV so that A, you make all the nutrients in the skin, not just vitamin D, but all the others. Okay, and I'm actually saying something that the WHO appreciates because you need to be in the sun as opposed to relying on vitamin D supplements. Okay, so they should be very happy with me. But of course, if you live far, far north or far, far south, or if you live in a polluted area or a cloudy area, or if you are very religious and you cover your skin completely for modesty reason, etc., well, you might need to consider your options because you will be deficient, and then even by world standards, when you are severely deficient, you do need a supplement. And I have a perfect one to recommend, which is 100% natural, which comes from organic mushrooms that have been exposed to UV light. So they manufacture the vitamin D and other nutrients within them. And there's nothing else in the supplement. It's just those organic mushrooms that have been exposed to UV. You take that supplement, you get 2000 IU. If you need it, I'm in the sun, so I don't take vitamin D, okay? You don't want to overdo it. It can actually cause some cardiac problems and some calcification of the coronaries if you do too much. And a lot of people take too much. It might reduce the risk of some cancers, but it might increase the risk of some cardiovascular issues. So it's better to take a moderate dose if you're not in the sun, but it's best to be in the sun, okay? So SPF products will be terrible for you in response to that. Just find out what's going on. We can work on the inside of the body, and then you can gradually get rid of them. I can also peel them off for you, no problem to peel them off, but you need to treat the inside so that you don't keep generating them, okay? Other question?
Next is Jen. I don't know how much more time you want. We can go on as long as people want. So Jen, you're next.
Okay. On that note, what do you think of the squirty vitamin D lamp for people who live in northern climates?
Anything that gives you UV exposure in the right ratio of UVA to UVB at the same time is going to be beneficial by comparison to having nothing.
Okay.
You have to look at the specifications and the ratio, because you may have, over a long period of time, some cumulative damage from something that is not exactly as nature intended. For example, too much UVA and not enough UVB. You know, you need the right ratio. I mean, obviously UVA will always be much more than UVA portion, like 95% to 5.
Okay.
But a lot of time people are afraid of the UVB, so they just get mostly UVA and they get only 1 or 2% UVB. Then they will have skin damage. Okay, so that's mostly a complicated thing. I would highly suggest moving to a southern climate, or at least take long vacations in the tropics. You can come to our southern Florida retreat in the dead of winter, where everything is dead, and enliven yourself with the sun every day at noon, like we do. We have a special sun deck where you can go naked in privacy for people who come to do our health retreat, where they are exposed to a healthy lifestyle that is easy to do, tasty, satisfying, quick, and continuous. You can do it for the rest of your life without a problem, because it's common sense, it's logical, and it doesn't require too much fussing.
Okay.
All right.
And then you had mentioned photobiomodulation. Have you tried the LifeWave patches?
Well, Lightwave is a good company, first of all. And they have different products that honestly, I haven't tried their products because I don't personally have time to engage with stuff like that in doing facials. But they do have good products that and they have really good device that you can get in your own home that is professional quality, professional level. None of those $20,000, $30,000, $40,000 unit, but something that you can buy that is professional.
I'm talking about like the patches, though, the patches that use your own infrared light.
Oh yeah, but then it's not exactly, it's not the same as photodynamic therapy, which is different from photobiomodulation. So photodynamic therapy is when you're using light with photosensitized agents that are being activated by that specific frequency. And each product has its own specific activation frequency that has been studied in a Petri dish. This is good science that is in the literature. And we know exactly which frequencies of light you need for which specific product. So if you have those products in something like a cream, I mentioned earlier that I would not be opposed to people doing it once a week, or at the worst case scenario, twice a week, for a short period of time to treat their skin with some of those agents that are activated by being sensitized through the photobiomodulation device, which has to be sufficiently strong to have a real effect, professional quality. And then you can do it at home. Once you learn how, again, my goal is to treat people not by providing the service in a clinic, but to educate them how to do it at home so they can treat themselves once a week for the rest of their life, and they don't need to poison themselves by smothering their face with poison throughout the remaining of the week, the remainder of the week.
Okay. And then a few people in the comments had asked about urine therapy.
Yeah, that's a whole interesting discussion. It's making a splash lately. I mean, when you throw the urine in the wrong direction, it will splash. So lately, a lot of people talk about urine therapy, and in some of my big interviews that were done in those large docu-series that are seen by more than 1 million people, I've been asked quite a few times about urine therapy, even though it was completely unrelated to the topic. And yeah, there's a lot that we can say about it that's potentially very beneficial, and there are some things that we need to question about it. So I'm not going to, jump into this urine issue right now, even though it smells good and feels good and warm and fuzzy, especially when you're still in your own diapers, or when you're still in your mother's uterus. You are continuously bathing in your own urine, which is probably a lot of fun. And that's one reason we want to get back once we got out. So I think it's a very good topic for another lecture. How about that?
Okay.
All right.
Thank you.
Yes. If we
All
haven't
right,
pissed
so-
you off, we'd love to have you come back to talk about urine. Now for our guitarist and folk singer, Susie McKee.
Not folk, it's country, but although there are country folk. So yeah, I was gonna ask about more like the urine stuff for the face, but the big thing is castor oil. What about castor oil for the face, for the body, various spots of the body?
I mentioned oils. I didn't. I did mention oils initially a long time ago today, and how I would not put any actual oils, any concentration of fatty acids in an oily phase. I would not do that to my skin, because it will dilute your own stratum corneum, your own natural skin fat. And I don't care about the gimmicks in the marketing industry that has been selling castor oil for many decades, and I know where it comes from. I don't need to be told who created that ideology, and I'm sure that some people benefited when they had a specific problem that deserved some castor oil pack that they used locally on a certain lesion. I know that it was helpful for some people. But from that into a blanket statement of using it regularly on my skin, on my healthy skin, I would not do that to my poor microbes. They just don't like castor oil. They told me that they just don't like the taste of it. Castor oil is not something that I would, do for my friends. My
What
friends
about
are
over your liver
might
for a
be-
liver pack?
Okay, so again, it's either you're talking about it for the skin, or you're talking about it for internal organs and other things that people can use it. Remember that the oil in it is polyunsaturated. It's polyunsaturated fats. They easily and rapidly become rancid. And that rancidity, those free radicals will easily, those peroxylated fatty acids are going to penetrate through your skin and damage your dermis and create free radical damage inside your dermis. To each his own. I'll just tell you what I think about it, but based on biochemistry and my knowledge of physiology and science, I wouldn't do it. But if you have damaged yourself for 50 years with a huge thick amount of makeup, and I think that I know that this could be an issue in this case, then the skin has been so damaged from all those years of assault. I mean, think about it. We are being militant. People who are such pacifists, sometimes the way they treat their own skin is so militant that I wonder why don't they act, in a pacifistic way towards their own face or their own skin. But once you have damaged your skin that much, you almost have no choice but to build a huge wall to prevent the illegal immigrants from crossing through. And that wall will be your castor oil. So you made a whole wall, but you are behind that oil. There's a lot of toxic stuff, a lot of fentanyl, a lot of, terrorism. Who knows what people have on the other side of that border, and they're still damaging your skin, and you're still covering it up. I don't know if it's a necessary thing to do when you're still young enough and healthy enough. Plus, you have a lot of good things going for you, like dancing and not folk music, but country music.
Yeah, I'm just curious. I mean, because I'm more interested in putting it in the belly button, which I've heard about, and also the patches if necessary.
It sounds like fun. Yeah, the belly button sounds like fun if you have somebody to help you kind of, take it out.
Okay, well, what about urine on the skin? Urine on the skin.
Yeah, again, some people claim, some people do have a strange aroma. And some of my patients put urine on their skin, and I smell it when I treat their skin. I can smell the urine. In some cases, it doesn't smell so bad. In other cases, the urine had a lot of agents in it that made it smell pretty noticeable. To me, it was worse than garlic because I like garlic, but some people are socially inclined to avoid that smell. Some people have really clean urine and they know how to process it so that it will not smell very poorly. And they are welcome to I don't think it will damage them too much, although the pH might not be exactly the same as the skin, but it's definitely closer to the skin's pH than castor oil or other things and creams, because the skin is supposed to be slightly acidic, just like the urine. But some people's urine is far too acidic. And then it's, so it really depends. I don't like to make blanket statements about stuff like that, because it might be good for one person and bad for another. And I want to see results in 99% of my patients. I don't want to have a 50-50 or 60-40. Make sense?
Yeah.
All right. Okay.
Thank you.
Are we all done for questions
Well,
today?
there are questions in the chat, but it depends on your time schedule and what else you need to do.
I have a lot of other things to do. I have reports and patients and other things. I think 2.5 hours almost is respectable. Of course, we can be here forever, but that's what these Zoom talks are for, and we will do other talks in the future about other topics. Usually I select them, but maybe one day we'll get to the urine topic when I talk to my patient and friend, Jonathan, who pushes the urine issue a lot today, and he and his entire family are my patients. So I get to smell urine often, and I'm used to it by now, and I don't mind it. And he's a great guy, and he's doing all my tests, and he's promoting my work very nicely without me even asking for it. It just we see a lot of patients coming now for skin cancers and other things just because of these docuseries that I've been interviewed on a regular basis. And since he comes to my house often for his own family, I end up, he just pulled out the camera and we improvise every time. So I know that he is probably the single most effective promoter right now of urine therapy. And I will read some of the research that he has collected before I do a lecture on the topic. I know a lot about it, but I don't feel like I know enough about it. I have books from 50 years ago on urine therapy. I want to read some of the more recent science to complement that old information before I revive the urine therapy of the 60s and 50s and 70s and bring it to the 2000s with additional science. And I will talk to Jonathan about compiling all the research so that I can put it together scientifically and medically in a relevant way to a large segment of the population without harming anyone. All
Well, I
right,
want to
thank you
thank you,
so much.
Dr. T, for your time and expertise. This was fascinating. I loved it.
Welcome.
It's exciting. We want you back as often as you can tolerate us or me. And it was fantastic. I mean, you know, you're a genius, a chiropractic doctor, a medical doctor, a nutritionist, a lot of, you know, philanthropic endeavors in various countries, more certificates than I can even imagine. And so I want to thank you so much for your time, your big heart, and your sharing. Thank you. Namaste.
Thank you so much.
Thank
Be
you.
healthy. Bye-bye. See you
Bye-bye.
soon.
Okay,
Thank you.
bye-bye.